Today we're speaking with Dr. Robert Railton of the Upper Canada Dental Centre, and we're going to talk about implants. Dr. Railton has been placing and restoring implants for over 20 years. Dr. Railton, I guess the first thing, explain to us, what is a dental implant?
A dental implant is a prosthetic that we use to replace a missing tooth or missing teeth. And basically it's a titanium post, and I have a model of the implant right here. I brought this model out the other day and the patient almost jumped out of her chair. Obviously this is a larger scale version, but just to show you, this is a dental implant. It's made of titanium, and titanium is the important feature here. Bone literally grows in and will integrate with titanium, and that's what gives it all the strength, as opposed to the original version was stainless steel. They didn't last. These stay in forever. The implant is placed where the tooth was missing. Into that is the abutment, and then on top of the abutment, the final stage, the crown is placed like this. This is done over a few stages, so typically it's a 6-month process from beginning to end.
Excellent. Are there different types of implants?
There are many shapes and sizes of implants and different reasons for using implants, and also different manufacturers of implants. Excuse me, we use the Nobel system, which is the original system, and I feel still the best system for single implants. I also love to use, this is a 3M product, mini implants. Mini implants are not, they're mini, they're not big enough to hold teeth, but they are beautiful for retaining dentures. So in a case like this, lower denture, not much retention here. If we place 4 mini implants and then in the existing denture place 4 attachments, the denture adheres and it's a life-changing procedure.
Okay, are there alternatives to implants?
Basically there are 4 alternatives. One is doing nothing at all. When you lose a tooth, the problem is when you lose a tooth, the adjacent teeth are going to shift into that area. The opposing tooth is going to grow up into that spot and throw your bite off completely over time. That's not a good option. Option 2 is something removable, which is a denture. And if you're missing, a bunch of teeth, that's not a bad idea to have something that comes in and comes out. But obviously, not the best idea. There's also a bridge. We've been making bridges for years. A bridge means you crown the tooth adjacent to the space on both sides with a false tooth in the middle. That's cemented on permanently. And that works very, very well. But you have to now bring those other 2 teeth into the treatment plan. You have to cut those teeth. So the implant doesn't touch those other teeth at all, and is therefore the best way to go.
Okay. I would say that probably the question in everybody's mind is this a painful procedure?
Everybody asks me that, and when I say I'm going to place this and I'm going to screw this in, they say, "Oh my God, that looks terrible." There is no pain whatsoever during the procedure. There's a little pressure. You're completely frozen. Afterwards, it's sore that night, of course, and it's sore through the next day with minimal swelling. But most people tell me that it was the easier procedure than an extraction.
Okay, excellent. Well, thank you very much, Dr. R.
Thank you.
For more information, you can visit their website at uppercanadadentalcentre.com, or certainly stop by their office, which is located at the Upper Canada Mall on the lower level by the bay. Thank you.
Thanks.